Welcome to the Mental Health and You podcast. This podcast brings you information and advice from across the Norfolk and Suffolk NHS Foundation Trust, with a range of teams, services and those who use them sharing their experiences and wisdom with us every fortnight.
Okay, we're very happy to be here to speak to you on the Mental Health and You podcast. My name's Vicki Malcolm. I'm an occupational therapist. I've worked for about 1 year now at NSFT, and I'm part of quite an innovative pilot project which has been started by NSFT to run a new community mental health team for people who need long-term rehabilitation because of severe and enduring psychosis. So it's called the Rehabilitation in Complex Psychosis Community Mental Health Team. And we've got Annabel here. And would you like to introduce yourself?
Hello, I'm Annabel and I'm a volunteer with the NSFT for the rehabilitation team. I have an extensive history in with serious mental illness. I was in hospital for 7 years and I'm now out 4 years clear on Wednesday.
I didn't know it was like the anniversary that was coming up, Annabel. That's amazing.
Yeah, 4 years on Wednesday.
Amazing.
Without one admission.
Oh, that's fantastic. And does it feel like it's been a good 4 years?
It's been a very good 4 years. It's been rocky, but it's okay.
Yeah. I'll just talk a bit about the background for this new team. So we were very lucky that NSFT decided to go forwards with the idea of a new community mental health team for people with complex psychosis. And the impetus for this came from some of the longer term plans in the NHS to try and provide a better service of care for people with psychosis. So around the country, there's about 370,000 people with serious mental illness. And at times, it's felt like the type of services that were needed to give them the best possible care haven't been in place. So through the long-term plan, the NHS in the UK, in England, decided to go forward with something called community transformation, and we're a part of that. So we are a pilot project, although we've been told now that we're able to sort of go ahead with the project through to April 2024, and that after that we'll be a part of the ongoing funding for the trust, which is really exciting.
Very exciting.
Yeah. So Annabel, you were actually involved in the project before I was. So yeah, it'd be really interesting to hear about how you first heard about it and how you got involved.
It started off, I strangely enough just went onto a website. I think it was the NSFT website, and found this opportunity to help with the mental health system. I found that a group commissioned to co-produce the mental health system. So I started there, and then we had a work stream for rehabilitation, and that work stream brought me into the team of rehabilitation, and from then I have grown from the start of the project to now, and I've seen it grow, and it's been quite a good experience.
Yeah. I think it's absolutely fantastic that service users were brought on board kind of before the staff, really.
So we sort of molded the staff to what we wanted.
Absolutely, yeah, quite right too. And I think from what I understand from when I came on board, the sort of things that service users were saying is that they wanted it to be a very kind of holistic team where all the different sort of functions and all the sorts of care that people needed could be provided within that team.
Yeah, and it was co-produced, so it wasn't just staff, it wasn't just patients, it was a co-production of both. And I feel that really helped because it meant that we had both perspectives, and it was quite good to have both perspectives taken into account rather than just us saying, I'm an expert by experience, so I know everything. I've learned from books, so I know everything. Well, you don't, and it does take co-production to present something as important as the mental health system.
Yeah, absolutely. And also, I guess that the group of service users that this team supports, there may be people that might find it more difficult to get their views across and who might need more support to do that patient involvement.
Yeah.
Yeah, absolutely. So then we went into a period of sort of putting the team together. And during that time, we tried to hire people who really wanted to work in a rehabilitation team. So we looked a bit at what people's values were. And NSFT has got some values-based interview questions, which we used to try and determine that we're getting the right sort of people into the team. So we've aimed to hire people that really wanted to work on helping people with their personalized recovery. You know, people might have a goal of getting a pet or starting a volunteer job or, you know, improving their home. It might not be the mental health goals that they want to work on straight away. It might be more about their quality of life and how they can have a meaningful recovery even whilst having a mental health condition.
But I think quality of life is affected by your environment. So if we can catch people's environment and what they like and what they feel is important in their lives, that's the way forwards. Because if you don't have that environment, then you're going to go round in circles because you're going to get not involved in these activities, and then, you know, it's going to go in a complete circle and you're going to end up in a rut where you just like going round and round.
Yeah, absolutely. And one of the groups that this team set up to work with is those people that are maybe in and out of hospital. So they might have had 4 admissions within 2 years. And the good thing about this team is we can go and see people wherever they are. So we can go and see people that live in their own homes, in housing associations, in supported accommodation, or who are inpatients as well. So we've been doing a lot of work with people that are in hospital at the moment, trying to find what the best kind of environment is for them to then move on to, exactly as you're describing, really.
And I think that's really important, because if you've got somebody that works with you from the beginning of your discharge and they meet you in hospital and then you're discharged with them, I believe you're going to be more successful, because you've made that initial relationship before you've left hospital, so you trust that person.
Yeah, absolutely. In terms of who we've hired into the team, so we've got a lot of different organisations that sit within the team. And what we've tried to do is to set the team up to be hosted by NSFT, but to have lots of different organisations within it. So we've got 2 social workers from Norfolk County Council. We've got 2 workers from Change Grow Live, which is the drug and alcohol service. So they're embedded within the team and they can work with us on things like people's substance misuse issues. We've also got 2 recovery workers and 2 peer support workers, and also a recovery worker manager. And they're hired through the Together organisation, which is the organisation that does people's support work. And then we've also got a legal advisor, which is quite unusual for a team to have. The legal advisor helps with things like debt issues, with people that might be having legal trouble, and can help to direct service users towards things like help with housing.
Yeah, I think that's really important.
The service user group that this team is set up to help are people who've got quite a complex mental health condition, for example, schizophrenia, and who might have found it difficult to contact services or to keep up regular support from services during their engagement previously. Some people call this group a hard to engage group, but we like to try and think about it a bit differently, that it's our job to find out what that person wants and then to try and support them in a way that they will accept and a way that they feel is appropriate. So we don't tend to use the term hard to engage, but we do tend to use the word creative engagement. And that might be about trying to help someone who's got a particular issue that they feel is very important in their life, and an issue that they might accept help with from us. I'll give you an example. So we've been working with a budget, a special project about personal health budgets. And we've been doing things like, you know, helping people to get curtains for their accommodation, helping people with things like moving costs where that would help their mental health, and helping people with, you know, getting into, for example, the gym, if they feel like they would like to go to the gym, we've been able to sort of fund that through the personal health budgets. So trying to identify with people what it is that would help them in their life, and then trying to help them with that is a great way to get people on board with the idea of engaging with the community mental health team.
I don't believe anyone is hard to engage. I believe that you're obviously not engaging them in the right path. If you feel it's hard to engage, that's because you're not doing your duty to that person, because everyone will engage if they are engaged in terms. Like, if someone said to me today, oh, let's go to the park and play football, I'd say go away. But if they said to me, Annabel, would you like to do some craft? I'd be like, yeah, and that would be it. That would be me on that line. It's not because I don't want to engage or I'm hard to engage. It's because that's not something that I feel would engage me.
Yeah.
And everyone has their own personal engagement.
And that brings us back to the low caseloads of this team, really. So having those low caseloads means that people can go out and see service users regularly. And that can mean that you can be consistent and available for those sort of activities so that people can build up some trust with services again.
Yeah, it's that trust that you need. If you take someone out bowling and then you start talking, you're going to get a lot more response than if you say to someone, right, let's meet in the office at 10 o'clock. They're going to be a bit more on edge and less likely to engage. So just engage people in what they believe that is important in their life. What's meaningful for them may not be what's meaningful for you, but for them, that's how they'll engage, because that's something that's meaningful for them.
Oh, that's beautifully said. Another thing we should talk about just briefly is about people's physical health. So obviously when someone's got a serious mental illness, they might have physical health conditions for all sorts of reasons. One could be that they've been unwell and they've not been able to take care of themselves as best they would have wanted to. Another one can be things like side effects from medication, unfortunately, especially some of the antipsychotics can make people or potentially have other cardiovascular risks as well. So the team is really trying to be very hot on supporting people with their physical health. And one staff member that we've got starting soon that we're very excited about is a physician associate. So this is someone that's trained in elements of supporting physical health care. And this member of staff is really going to help us with things like getting people their physical health checks. So we're really looking forward to that, because we feel like you can't really separate someone's physical and their mental health.
Yeah, mental health can affect physical health can affect mental health, and in my experience, physical health is not really dealt with appropriately, and I believe that this team could offer physical health. I've seen them taking someone to the gym, and things like that.
Yeah, it's definitely something that we want to try and focus on quite strongly. You'll probably mention on the podcast we've got another special guest in the background occasionally, Annabel.
Oh, sorry about that. That's Lily Rose. She is the resident dog. And her picture is up on the wall in the office because she's so beautiful.
She's on our pet wall. She sits above my desk.
But sorry about that. She's decided she wants to cry and there's nothing I can do.
It's worth commenting on, though, that I think, is it fair to say that she's been quite a good contributor to your own recovery?
She's been an amazing contributor to my recovery. It's just something there. And if you're just feeling a bit low, she just sits there with you. You can stroke her. She's really important to me and to my recovery.
Yeah.
And she's very important. My little Lily Rose, she's called.
Yeah. And I think, like, bringing it back to the team, I've been really proud of the way that the team have been able to sort of work with creative goals, like helping to get people pets. I mean, that's actually been something that we've managed to do for a service user.
And I have spoken about pat dogs because they're really important too. If you can get a pat dog involved.
Because, absolutely.
And it often, what it does is it takes the focus away from the meeting. So you could have a conversation with someone, and if there's a dog or something there, it takes the focus away. So it's not you sitting there talking to someone. You're talking to someone whilst I don't know, stroking the dog, washing the dog,
Yeah.
brushing the dog, walking the dog. There's all sorts of things you can do with the dog
Yeah.
that can open up conversation with somebody who's finding it difficult to communicate. I mean,
Absolutely.
at one point I had this team that looked after me, and if I was in distress, then I'd press the red button, they'd ring, and the first question they would ask was, "How's Lily?" Because they knew that Lily was the way to my emotions.
Yeah. So it gave them that knowledge that there was someone that you cared about, that they could communicate with you about.
Yeah, and I think that was really important. So if we could do that, that would be really important.
Yeah, absolutely. The rest of the staff that I haven't mentioned so far, so just like most community mental health teams, we've got mental health nurses and we've got occupational therapists. And the people that we've got doing that caseload holding job, who are the care coordinators for the service users, they have about 15 people each. So that's quite different from the other community mental health teams where people might have 30 or 35 service users.
And I think that lower number is a lot better, because not only do they get more individualized time, the person gets time to meet them, to understand them, and I think that's really important.
Yeah. So we've also got some kind of multidisciplinary team staff. We've also got a psychologist, and I think, that's very, very important, especially when you're looking at trying to support people with psychosis. So they've got access to cognitive behavioral therapy, and also they've got access to family work to support carers as well, help them to understand how best to support their person. So that's been something that we've been looking to make sure that people are trained up in as part of being in this team. So that's covered a little bit about the staffing. So Annabel, do you want to tell us a little bit about the project that we're running at REST at the moment?
So REST is a mind organisation that facilitates the meeting that we have. Rest in Mind has a nice cafe, and it's a very nice environment. And anyway, so what we do at REST is we provide an activity for those within the rehabilitation team. Often we'll do crafts, or recently we've done some mood boards and affirmation jars and things like that. But anyone can come up with an idea if they feel that they want to do a particular activity one week. We have had people suggest that they wanted to do clay, so we put on a little clay activity, and it's really quite friendly and inviting. There's free tea and coffee sometimes. And biscuits. Don't forget the biscuits.
Absolutely.
And it's a very good environment, and we are looking to expand to bring in more individuals, and hopefully that will happen soon. But at the moment we're running on a couple of people a week, but we would like more.
Yeah. And that's open to all service users who are under the rehab team.
Yeah.
I think what's great about it as well is because it's based at the REST Resource Centre, it gives them a chance to come in and see all of the other activities that happen at REST.
And it's sort of like a springboard, as they call it, isn't it?
Yeah.
Like you can go in and you can just go, even if you don't feel like doing the activity, if you just want to talk or you want to sit and listen to other people talk, it's a really nice activity, and it's somewhere where it's nice, calm, relaxing, and people understand that mental illness is a thing.
Yeah, absolutely. And something else we've been doing to do with REST is we've been trying to make you an official volunteer, haven't we?
Yeah, hopefully soon. Filling out forms and interviews, and oh gosh.
So NSFT recently reopened the application process for volunteers, and so they asked us if we wanted to have a volunteer role within REST, and we've been working on creating a job description for you to apply to.
Yeah, and I'm really hoping that I get it soon, because it's I love doing it on a Thursday. I do every Thursday religiously 1 till 3. But it would be nice to be, I know I'm recognised as a team member.
Yeah.
But it would be nice to be officially recognised as a team member on paper.
Yeah, absolutely.
It's made me grow as a person from when I first started to now. I've really grown as a person and feel like I have the ability from the team. They've given me the confidence that I can do something, and I really want to go on to do an OT now because of the way that the OTs have treated me.
I think you make a wonderful OT. I look forward to seeing that in the future.
Hopefully.
Annabel, you were a big part of our very successful launch event when we then started the team in September. And I'd love to hear about what that was like from your point of view.
For me, it was interesting. It was insightful. I really enjoyed being able to go on the stage, have my say. Guess what? I had a longer queue for my activity than for cake, and that's always good if you're beating cake. And I just spoke about my history, how I became involved in the mental health system, how why I spent so long there, and things like that, and how the team has helped me to grow from what I was to what I am now. And I did a little activity about where everyone had to make an origami dog and put it on a paw print board with a comment of what they thought rehabilitation was.
Yeah.
And it was well responded to. I still have the poster with all the little dogs on because it meant so much to me to be able to be involved in the launch event at first, and also be such a influential role. I even had someone come up to me and say that I've given them hope for their daughter who had autism, and given her hope that you can do things. Autism doesn't mean you can't do anything. It just means that you have to deal with things in a different way. Being neurodivergent is not wrong.
Absolutely, yeah. And I think, hopefully the world is starting to understand that. I also think that, in some ways the world is becoming more understanding about mental health conditions. But
I think it's less of a taboo. You sometimes I find it difficult if I'm trying to make a friend, which find very difficult. It's like, how do you explain yourself without people then running away? And I think that's something we still need to work out as a society, how we deal with people's mental illness, and how things like schizophrenia or schizoaffective or whatever doesn't mean that they're murderers or that they're going to do this or they're going to do that. It just means that they need to deal with the world in a different way.
Yeah, absolutely. And I think the team is really important in that we can support people to overcome some of those barriers and some of that stigma that they might feel they face.
Yeah,
And
and also
maybe just to have the confidence to go and try new things that they want to do.
And when they're coming out, if they know that, there's a team around them that will support them with those activities, that will make them have a good mental health. Because if you're staying at home all the time, or you're in hospitals, for instance, and you're not going out to do activities, you're not seeing different people, you become institutionalized and then you're stuck. But if you've got a team that then comes in and supports you until you actually have the ability and you have the confidence to leave the hospital, leave the institutionalization, and learn that there are things in life that you can do.
Yeah,
and
absolutely.
That the team really, I believe, supports in that sense, that they go into the homes, they go into the hospitals, they bring you out, they do the things. There's so many people in the team to help you with anything, like we've said, law issues, physical health, mental health. There's someone for everything. OT. There's a bit of everything for someone. And it's not like when you come into the team, you're told, right, you can only do this and it has to go in this particular way. Your pathway is your pathway, which is individualized. So if you feel that something's important to you, then that's what we should focus on.
Yeah,
and I
absolutely.
feel the team's really good with that, focusing on what's good for that person.
Yeah. Well, thank you so much for being my guest on the podcast, Annabel. It's been really, really useful to hear your insights.
Thank you.
And we've heard a little bit from Lily as well.
Of course.
Thanks for listening. Please subscribe to make sure you don't miss a future episode. Let us know what you thought of this episode by reaching out on social media. If you haven't already, listen back to previous episodes to hear some of the best mental health advice for you.